All right, guys, welcome to our Let's Talk About Poop. Yeah, let's do that again. All right. Welcome to our Let's Talk About Poop podcast, where every Monday I do a podcast on topics you guys want me to talk about. So if you're joining me for the first time, my name is Dr. Islam. I'm a board certified gastroenterologist trained at the Mayo Clinic. I currently work at Lubbock Gastro. Come see us, Lubbock Gastro, for all your GI needs. So every Monday I do a podcast in which I do a deep dive into a topic you guys had asked me about. So this is a format that we do. I do a deep dive on the topic, I answer questions about that topic, and if you're on the live stream on my social media channels, LinkedIn, YouTube, Facebook, Instagram, you can answer any questions you guys want on the live stream as well. If you're watching on the or listening to the podcast, obviously you can't do that, but that's okay because I'm hoping you're going to get good information as well. There are a couple of different ways you can communicate with us. Number one, let us know on the live stream what questions you have, but also send us a message via DM, send us a question via our website as well. And we always like to hear what you guys have to say. If you haven't already, don't forget to subscribe to my channels, like us, give us a 5-star review on our podcast, because apparently the social media giants, including Apple and iTunes and Spotify, help to promote podcasts if they are 5 stars or more and they get good reviews. And you know anybody who likes information like this, don't forget to share this information as well. We have a great show tonight. Tonight, we're going to talk all about diverticulitis, a very common question that I get from my patients about what exactly it is, how do we treat, how do we diagnose this, how do we prevent it, and what can we do to make sure you don't have it. So if you've been suffering from diverticulitis, we'll do our topic today on that. And as usual, if you have any questions going on that you guys want me to answer, I want to hear this as well on the live stream as well. If you're watching the live stream, let me know if you're watching this live on the replay, and also let me know where you guys are watching this at as well. So without further ado, let us begin. So what exactly is diverticulitis? So when it comes to diverticulitis, it's important for us to understand definition and vocabulary, because it's very different from a condition called diverticulosis, which a lot of people have. Almost 40% of the US population has diverticulosis. Now, diverticulosis are outpouchings in the colon. Very common to have. And the main reason why people have these outpouchings is because of old age and constipation. So as we get older, the lining of our colon becomes thinner, and that causes these outpouchings to occur. And the sheer force of that stool hitting the colon will cause these outpouchings to occur. Now also, as we're having constipation, the impact of that stool, that pressure, will cause these outpouchings to occur. This is diverticulosis. Very different from diverticulitis, which is actually an infection of those outpouchings. So when you hear the term itis, that means infection. So if you have pneumonitis, you have infection up here. If you have, for example, meningitis, is an infection of the brain or the spinal cord. And same thing with diverticulitis. If you have diverticulitis, it is inflammation of those pockets. And the reason it gets inflamed is because something gets stuck in those pockets to cause irritation and inflammation to occur. And so if we're talking about diverticulosis, that is normal, not a big deal. Don't worry about it. But when we talk about diverticulitis, this is when you actually have an inflammation in those pockets that can cause irritation to occur. And that is actually diverticulitis. So how do you know if you have diverticulitis? What are the symptoms? Well, there are a couple of cardinal symptoms that we know about that can tell me I think you have diverticulitis. The most common one being left lower quadrant pain. So pain in what's called the sigmoid area, which is the left lower quadrant area. Now, the reason you have the pain in that area is because this is one of the more common areas to have diverticulosis, which once again are those pockets. And if that area gets inflamed, that's diverticulitis. But also too, we have a sharp angle in that sigmoid, and that sharp angle can make it more likely for things to get stuck in that area to cause inflammation to occur. But because it's an itis or an infection, you have other symptoms associated with that. Fevers, chills, nausea, vomiting, and you can also have rectal bleeding. But the cardinal symptom is left lower quadrant pain, which is typically in the area of the sigmoid where we commonly see diverticulosis. So what exactly causes diverticulitis? What are the causes? Well, number one, we know that age is a risk factor for developing diverticulosis, which also means that age is a risk factor for developing diverticulitis. The older that you are, the weaker the walls of the colon are going to be, the more likely you're going to develop inflammation of those pockets that cause diverticulitis. We know that smoking is a risk factor for diverticulitis. If you're smoking, A, don't do it. It's nothing good with that. But also B, if you're having recurrent diverticulitis, this is going to be a cause for that. But also C, taking certain medications can also predispose you to develop diverticulitis. So let me tell you a story of a patient of mine. I had a 30-year-old man coming to see me for recurrent diverticulitis. Every couple months, he had inflammation of these pockets that just would not go away. It was always going to be there. He came to see me and I did a CAT scan. And yes, I was like, okay, you have active diverticulitis. Why are you having recurrent episodes? And lo and behold, I come to find out that he was actually taking an anti-inflammatory medication for his pain. And guess what? The biggest risk factor in terms of medications that are going to cause diverticulitis are anti-inflammatory medications. Aleve, naproxen, Advil, Motrin, meloxicam. These medications are known to cause diverticulitis. So I told him to stop his medication, and in the process of doing that, this will hopefully resolve his diverticulitis. We know that food plays a role as well. And I'm going to go into this, but it may not be the foods that you think about. But there's certain foods, especially red meat and foods that are low in fiber, that can make diverticulitis worse. And sometimes these things can also make things more complicated when it comes to diverticulitis. So now that we think that we have diverticulitis, how do we diagnose it? Well, let me give you a hint here. It is not a clinical diagnosis. So I have a lot of patients that come to see me. They say, hey, Dr. Islam, I've been diagnosed with diverticulitis. Give me some antibiotics. And the first question I want to ask them is, how do you know? Because it's not just a physical exam. If I have you coming to see me and you're having left lower quadrant pain and fevers, well, guess what? There are other things that can cause that. Or if you just have left lower quadrant pain, there are other reasons why you can have that. And so a history and physical is not enough to diagnose diverticulitis. We actually need a CT scan or a CAT scan so we can see the inflammation. What this tells me, it tells me the degree of inflammation. It tells me the location of the inflammation, but also tells me, do you have any complications from that as well? Mainly an abscess or what's called a fistula, which is the connection between two different organs. And so you must have a CAT scan to diagnose diverticulitis. So I will tell you, if you've been diagnosed with diverticulitis without a CT scan, in my book, you don't actually have a true diagnosis because we need a CT scan to confirm that. We also need a CT scan to allow us to see kind of what's going on, because that's the only way for us to objectively know if you have diverticulitis. So let's say you got that CAT scan and you've been diagnosed with diverticulitis. What do? Well, we need to give you antibiotics to control the inflammation. So because you have an inflammation, an itis going on, we need to give you antibiotics to control that inflammation. And so we typically give you a course of antibiotics, maybe Cipro or Flagyl or metronidazole, to help calm down the inflammation. We can give this for, roughly about a week or so. Once we do that, we want to get to the root cause of why. Now, other reasons why you can have diverticulitis besides the things that we talked about include having a polyp inside that area, maybe Crohn's or ulcerative colitis, or even colon cancer. Unfortunately, I've diagnosed patients with colon cancer in which their only presentation was diverticulitis. So how do we figure this out? We do a colonoscopy to see what's going on. Now, the important thing about a colonoscopy is that you don't do it in the setting of diverticulitis because you have so much inflammation. There's an excellent chance that I can cause a tear in the colon if I do a colonoscopy at that time. And so we don't want to do it at that time. We typically want to wait about 6 to 8 weeks after the inflammation is calmed down for us to take a look, see what's going on, and see if we can find a reason why. So if there's a polyp there, we'll take care of it. If there's evidence of Crohn's or colitis, we'll put you on treatments for that. And for the vast majority of my patients, if they've had one episode, there's not an excellent chance you're going to have a recurrent episode. But if you had 2 or 3 more episodes, those episodes keep on recurring over and over and over again. And for those patients, we may want to consider having you see a surgeon to remove that part of the colon to get the disease part out. But this is diverticulitis in a nutshell. Let me know in the comments down below or in the comments on my podcast, what questions do you have? Have you been diagnosed with diverticulitis, or is this a condition that you thought that you had and maybe you need to see someone like me to see if that's the case? Now, we can do a deep dive now on some of the other things. So, Dr. Islam, number one, what are the foods that can cause diverticulitis? So, this is one of my favorite questions to ask and answer because I see so many common myths that are out there that are confusing for both patients and actually doctors as well. Let me tell you what doesn't cause diverticulitis. Nuts, seeds, popcorn. These things have no evidence of causing diverticulitis. It doesn't matter what you see on the internet. I'll tell you based on evidence, we have no evidence that these are triggers for diverticulitis. So don't worry about that. I tell my patients, if you enjoy that, go crazy, not a big deal. I don't really care. But what foods do cause it? We know that a food that's high in red meat. So beef, pork, these foods are known to cause diverticulitis. So if you can minimize those foods, that's going to help out. A diet that's low in fiber is going to make diverticulitis worse. So low vegetables, low fruit are not good for your gut. And so if you want to do anything diet-wise to change what's going on with your risk factor, cut back on red meat and increase the amount of fruits and vegetables. This will help out with the gut microbiome and decrease your risk factors for developing diverticulitis. So of all the things I can tell you, that's going to be the most important thing that you can do. Next question about diverticulitis. Hey, Dr. Islam, how much fiber should I add to my diet to prevent diverticulitis? Well, the typical recommendation is between 20 and 30 grams of fiber per day, depending on the person, the sex, and the individual. Now, what I tell all my patients is the best way to get fiber is to have a high variety of fruits and vegetables. The best predictor of the best microbiome that's out there is a diet that has a wide variety of plants and vegetables. By far, this is the biggest predictor factor for improving your gut microbiome and for decreasing your risk for diverticulitis. So if you can do that, it's going to help out. For some individuals, they may not be able to do that for whatever reasons there are. And so supplementing with extra fiber, things like Metamucil, Benefiber, Citrusel, these things work as well. So consider adding that if you can't have enough fiber. Always keep in mind for some individuals, fiber can be a dual-edged sword, meaning too much fiber can cause bloating and distension, whereas if you take it too much at one time, it can cause a lot of issues to occur. But this is going to be the best way of what you can do to help you prevent you from having diverticulitis. All right, that is my deep dive on diverticulitis. To go into the main questions. If you're watching this on the social media streams, let me know if you're watching this live or on the replay. And also let me know where you guys are watching this at as well. So Christina asks, is there an age when diverticulitis starts? And the answer is it can start anytime. I've had patients as young as 18 or 19 have diverticulitis, and I've had patients as old as their 80s develop diverticulitis. So it's not an age predictor. However, like I mentioned before, the older that you are, the more likely it's going to be for you to have a weakened colon, and the more likely it's going to be for you to have issues with your bowels, which can predispose you to develop diverticulosis, which is also going to predispose you to have diverticulitis as well. And so even though it can occur at any age, older age is absolutely a risk factor for developing this condition. And so it doesn't mean you're going to have it, but it is a predictor. But like I said, also 40% of the US population will have diverticulosis, but certainly 40% of the population will not have diverticulitis. So I wouldn't worry about the outpouchings at all, but anyone can develop diverticulitis. Great question. All right, perfect. Next question. Next question on a different topic. Hey, Dr. Islam, tell me what is going on with fatty liver disease. All right, you may have seen in the news, there are more and more treatments out there for fatty liver disease. So let's talk about this. So fatty liver disease is a very common condition, and there are two main reasons why people can develop fatty liver disease. One is alcohol. So drinking too much alcohol can cause fat to accumulate in the liver to cause fatty liver disease to occur. But also just being a big person can also predispose you to develop fatty liver disease. Who's the big deal? Who cares? Why does it matter? Here's the issue when it comes to fatty liver disease is that it is now the number one reason why people develop liver failure. By far, it outpaces alcohol and the old number one, which is hepatitis C. And so many individuals have fatty liver disease and they don't realize it and they don't know until it's too late. So if you have the risk factors for fatty liver disease, you're obese, you have diabetes, you have heart disease, high blood pressure, you're at risk for stroke, you're overweight. These are all risk factors to developing fatty liver disease, especially if you have diabetes too on top of that. So if you have that, talk to your doctor about getting screened, whether it's with an ultrasound and some blood testing, so we can see exactly what is going on and find out what are the risk factors, and if you are one of those, in which we need to find out what we can do to minimize your complications when it comes to fatty liver disease. Great question. Perfect. All right. So another question asks, can you have spicy foods whenever you have diverticulitis? Well, the answer to that question is we have no evidence that spicy foods are going to make diverticulitis worse. So from a clinical standpoint, I don't care. If you want to enjoy spicy foods, that's perfectly fine. If you feel like you can tolerate it, not a big deal. But we have no clinical evidence that having spicy foods is going to make diverticulitis symptoms worse or cause any complications. So if you don't do that, not a problem as well. Not a problem at all. Great question. All right, perfect. Kevin, thank you for watching. Nero, thank you for watching. Christina, as usual, thank you for watching on the live stream as well. All right, guys. Perfect. Well, I think these are all the questions we have for today. I want to thank you guys for watching. If you haven't already, don't forget to smash that like button, like, share, and subscribe. If you haven't already, don't forget to subscribe to my channel, download the podcast. Let me know in the future if there are any questions that you have. And if you have questions about your gut health, you want to improve your health, or you want to make yourself feel better, come see us up at Gastro. Well, we're there to help you out with all your GI issues. I want to thank you for watching. I look forward to seeing you guys on my next video. Thanks and take care.